Okay, so I mean, to understand the UK situation, first you must understand the political context. And what we have in the UK is a government which was elected in December 2019 on the premise that it would take Britain out of the EU. That was its byword, that was its electioneering slogan, get Brexit done. And that was the basis on which that government had a landslide majority, 80, incredible result. And these people in government had all made a pledge to Boris Johnson, who's our Prime Minister. It was a very simple pledge. And what he said to them all was, if you wish to be in my cabinet, you must commit to the UK leaving the EU with or without a deal. Now, most people in the UK understand that our major trading partner is the EU, and it makes sense to have an arrangement or a deal with them. And it's pretty stupid not to. But that was what he put to the cabinet. Now, when he put that to people, there were people who felt that didn't make sense, so effectively they were sacked. So what we have is a very particular kind of cabinet. It's a kind of cabinet which is fixated on Brexit. It's a kind of cabinet that is fixated on Brexit, and it's also a cabinet that is inexperienced. So some of the people who had been around for a long time, like Chancellor Hammond, our Health Secretary, I mean, pretty senior people, they were out of government, and we have our current government is more inexperienced. If you look at the Prime Minister, the only major post he has held was as Foreign Secretary, and he was more or less sacked from that by Theresa May, and a lot of people had some serious doubts about his how well he did in that job. You know, was he really up to the mark? And some people would even say he was the worst Foreign Secretary we've ever had. So, you know, the inexperience is there across this government. That's the first thing you must observe. Then the next thing you observe is on the 30th of January of this year, we had our first COVID-19 patient. This was a Chinese visitor in the north of England who was on holiday. She was diagnosed as having COVID-19. And what was very interesting about that was the next day, the 31st of January, was Brexit Day, the day we actually left the European Union. So basically, we had a government which was in celebration mode and which was not alert to the danger of COVID-19. They were celebrating on the 31st of March that left EU. Some of us were desperately sad, of course, because I'm very pro-EU, I can tell you that. I always have been and voted to remain, and lots of my contemporaries feel really sad that we've left the EU. But the point is, the government was in a mood of jubilation and rejoicing. It had taken the eye off the ball. Then we had a policy of containment. And the idea of containment was that people who came in the country, often they would maybe come traveling in from Italy or something like that, skiing holiday, whatever it was, they'd come in, they would present themselves to their doctor, the health authorities, they'd be diagnosed as having COVID-19, and then our experts would track and trace who they had contact with, and they determine where all they came from, make sure they all got treated and so on. And this was what we were doing, and this was what we were calling the containment phase. Okay, the containment phase. Now, unfortunately, and this was not widely known. It wasn't widely known until just the end of last week. During that containment phase, the maximum number of tests that the government could do in any given day was 5. 5 tests.
5 tests.
5 tests. 1, 2, 3, 4, 5. You just need the one hand to count them.
Yeah.
And this is what you could describe as inadequate, hopelessly inadequate. And they continued on this containment phase and tracking and so on. But in the end, as the number of infections increased, when it came to the 12th of March, they just stopped doing it. They couldn't. They didn't have the capacity to do it. Now, the World Health Organization had said, test, 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 test. Here's your policy, test, test, test. We were nowhere near ready for that. Now, if you remember what happened in early January in Italy, and they were like 2 weeks ahead of us, you could see how infectious this disease is, this virus. You could see how infectious it was, how difficult to contain it, so on. But I think that we weren't necessarily following too closely. Perhaps too much celebration of the fact that we'd left the EU more than the lurking danger and awareness of the lurking danger. A bit of complacency and perhaps a bit of arrogance as well on our part of our government and our Prime Minister. So we had a situation where for a period of time we tried to contain, and it didn't work. And then there was this interesting debate which was suppressed, and this was a debate ran through February, early March, about herd immunity. I don't know if you caught this. There was a suggestion that some of the key experts who were advising the government were saying, let's let the infection spread and build up some herd immunity, and this is the way to deal with it. Now, this is a particular way that is approach which has been used with like flu and the flu virus. And the flu virus is also a coronavirus, but this is a different coronavirus. COVID-19 is something quite different. It's so persistent, it's so hard, it's so infectious. It is much worse than merely a respiratory disease. It is dreadful, yeah? And they didn't really understand what they were dealing with. Then in that period of time, there was a period before we went into lockdown. We went into lockdown on the 24th of March. So there you are, all of February, almost all of March, you know, without going into lockdown, despite the fact that the infection was discovered in the UK on 30th January, and it was increasing. It was also increasing, and this was in evidence yesterday at the House of Lords Select Committee investigating this, a committee where one of the government's advisors said that in the early days we didn't close our borders. Lots of people were coming in, millions of people were coming into the country from places like Spain and Italy and so on, and in China, and they were bringing the virus with them. So really, the public statements were that, you know, this wasn't all that important, really. But I think underlying that was the practicality that most likely we didn't have the capacity to deal with it. We had seriously undomesticated this. And just last week there, the Prime Minister was giving evidence to a select committee in the House of Commons. And he confessed that that we hadn't learned from previous experiences. So if you remember, there was SARS, there was MERS, there was avian flu. There's a number of these things that have come through epidemics, and we never learned from that. Also, interestingly, in the previous government, the previous Conservative government, around like 2017, they had a major simulation exercise on what would happen if we had a pandemic in this country. What should we do about it? But it was called Cygnus. But this government, this current government, which is quite inexperienced, hadn't even heard of it. There was a lack of awareness. A lack of awareness about these previous things and a lack of awareness here. Also, there was a sense that, you know, we could deal with this. And if there's something about a lot of these Brexiteers, it's a kind of, you know, is this kind of thing, if you criticize them in any way, you're described as talking down Britain, which is, you know, it's not loyal, and perhaps you're a traitor. The point is here that this wasn't talking down Britain. This was just like waking up to what was in front of us. And they had PPE, which they thought was adequate, but it was wholly inadequate. So we had this long period of time. And during this period of the first 5 weeks, the Prime Minister was criticised for being a part-time Prime Minister by his political opponents. And a lot of this was around, he has a very complicated personal life. In this period, he divorced his second wife and became engaged to his new partner, who's, I don't know, 30 odd years younger than him, and became engaged to her. And during this 5-week hiatus, this period, he was taking time off and going to his country retreat and having discussions about his divorce arrangements. And he was having discussions with his new fiancée, who also happened to be pregnant, about how he was going to look after her and so on. So you can see in that period, it was quite messy. Also, the Prime Minister proclaims to be a man of strong libertarian values, and he does not like the idea of constraining anyone whatsoever from doing what it is they want to do. So, for example, if you look in the run-up to lockdown, we had so many events on. With these events, and honestly, they were like huge. So, for example, international sporting events, you know, like England v Wales at Twickenham, where a Prime Minister went along to take part in the social event, the infection rate was increasing. But it's as if it was not that important, you know. It's the kind of thinking that you may have seen with Bolsonaro in Brazil and Trump in the United States. This isn't necessarily all that important, bit of a flu, blah, blah, blah. Very friendly, and it's okay, you know. Also, the cultural secretary, he, again, very inexperienced person, but he sanctioned the go-ahead of, I think, an event called the Cheltenham Festival. This is horse racing as a wider festival. I mean, you've got hundreds of thousands of people going to this event over a longish period of time. This became a hotspot for infection. Also, there was big football matches. Liverpool, of course, the champions of Europe, were playing in Liverpool against Atletico Madrid. And there are thousands of Spanish football supporters came from Madrid, which was a hotspot for COVID-19, and they brought it to Liverpool, which became a hotspot in itself. So there's all this kind of going on, and an absolute general reluctance to act in any kind of severe or draconian way. All the time, infection rates rising. Now, in that period, when they stopped doing the testing because they were unable to do it, they had made some useful initiatives. So, for example, they were aware that Italy had lost the fight. I mean, the hospitals were getting overwhelmed. We could see this on television, where there are intensive care unit beds in hospital corridors. I mean, you must have seen this yourself. I mean, it was just horrendous, really horrendous. So what they did is they put an extra capacity. They created new hospitals called Nightingale Hospitals. It was just a quick conversion of an existing building, and they had them up and down the country at Nightingales. And this was in case the hospital's capacity burst, you know, then they would cascade them into the Nightingale hospitals. They also, they didn't take part in the EU initiative. The EU had an initiative in which it was going to, as a single block, a trading block, negotiate for personal protection equipment for staff in the front line, and also ventilators for hospitals. And clearly, we could have been very short of ventilators in these Nightingale hospitals if the explosion in sick people did actually happen. So there we were in a situation where the government had the foresight to build these, a very short term, these rudimentary hospitals for patients with COVID-19. They had encouraged private manufacturers to make these things, and in fact, these respirators, ventilators, and in fact, a lot of them did. Extraordinary private manufacturing concerns who put it together. We actually used it with a Formula One team as well. They built these things and put them in hospitals. So we had taken some initiatives, you know. The other thing is that in tackling this, a major concern was to protect the health service capacity, the National Health Service. So it would be seen as being in the forefront of dealing with this entire issue of dealing with COVID-19. And but in this process, to protect NHS capacity, the government directed people to reallocate people who were in hospitals who were elderly and put them into care homes to free up more capacity for COVID patients. Now, when they did this, unfortunately, they did not test these patients for COVID-19. You remember I said we had a very limited testing capacity. And so what happened is that people were getting discharged into care homes, and the care homes were occupied by very elderly people. Some of them may have had dementia, diabetes, all sorts of illnesses, which made them very, very vulnerable to COVID-19. And there was a very obvious effect, and it's amazing that no one had thought of this, because this was in the Cygnus report that I mentioned, the Theresa May pandemic simulation from 2017, because that the virus just went through these care homes like a knife through butter. And we got an awful lot of mortalities in these care homes. Absolutely shocking, really vulnerable people who weren't being protected. And then we went into our lockdown situation on the 24th, excuse me, and the government allowed certain movements. So if you needed essential medicine or food, or if you needed exercise, you could go for a walk. But other than that, it was locked down. You weren't to go very far from anywhere. And that persisted right through March, April, May, and it just been relaxed just now. And it's not a profound relaxation. It's just a little bit of a relaxation. But one of the things that happened during the period of lockdown, when we were supposed to stay in our own locations and not to move beyond it, one government employee, this guy was actually the advisor to the Prime Minister, Boris Johnson, a man called Dominic Cummings. Right. He went on a 260-mile journey with his wife and his kid because he thought he was getting COVID-19. Now, the issue about this has become a furore, which is still raging and which has gone on for 2 or 3 weeks, because in lockdown, he didn't obey the rules. There are many pictures of him running from Downing Street because his wife had said she thought she had COVID-19. So he ran home to see her. Well, you could understand that. I mean, that's just something that people would do. You'd be upset, of course, you'd be anxious. But government rules said that if you had a relative who had COVID-19 or symptoms, you had to self-isolate, stay with them for 7 to 14 days. But he didn't. He went back to his work. So he disregarded the government rules then. Then he thought he himself was getting it. And he thought that he had no one to look after his kid, his boy. But we understand that he has, that his wife has family in London and that he has colleagues nearby, but he didn't actually pursue these options. What he did was he set off in his car to drive 260 miles to live on his parents' farm, where they had a little cottage that he could go in. Now, a few people brought this up because this happened during the lockdown period, but the story was suppressed. Journalists wanted to talk to him. He wouldn't talk to anyone, but it created a major stir when it emerged that this guy was breaking the lockdown. He's a guy who'd come up with the rules himself, and he'd make the rules, then he broke the rules. There was a lot of angry people, and especially you can imagine people who obeyed lockdown, but they may have had a parent who sadly was passing away, but they weren't allowed to leave their lockdown to go and see them before they died or to go to their funeral. You could imagine the heartbreak. There are people who had members of their family who were very seriously ill some distance away, and they just couldn't go to see them because of the lockdown. There was a lot of angst, and then there were some people who had really severe conditions, and they were in a very severe form of lockdown, and they were self-isolating. So an awful lot of people had put up with a lot of pain and a lot of misery to try and do their bit for the nation, and this guy had just gone through this, breaking this routine. Now, when it went public, people were very, very angry. They complained to their MPs complained to the government. It was all over any form of media, newspapers, television, social media. It just went berserk, yeah. And the Prime Minister it appears he's very dependent on this, his top advisor. And we have a comparative situation in Scotland where our medical officer went for a little wander to her holiday home on the weekends and broke the lockdown, and she was sacked for that. And rightly so, because she was telling people publicly to stay at home, but she wasn't doing it herself. It was just like hypocrisy. Yeah. But this guy got off, and Boris Johnson took his side, and he said he'd spoken to him, and he felt he had a perfectly believable story, and that was the end of the matter, and the matter was closed. And we have a daily press briefing from Downing Street, and he even took this, and people asked questions about it. He just refused to answer them. He says, "Matter's closed, matter's over," but apparently it's not over. And he had, while he was staying up in his parents' farm, he'd taken his wife out on her birthday, it just so happens, to a local beauty spot which was 30 miles away, which is another break in the regulations for lockdown. And what he said was he had some problem with his eyesight, so he wanted to test his eyesight to see if it'd be okay. Now, most people would say if you have dodgy eyesight, you shouldn't be driving at all. In fact, in the UK, that's a criminal offence. It's a road traffic offence, But he came up with this argument, and people were astonished. We even had MPs resigning and walking out over it. But still, he was defended by the Prime Minister. And a lot of people think that this has undermined the desire to so where we are now is we are still in lockdown. We've got some relaxation of lockdown. We have the Prime Minister has taken a severe battering in these opinion polls and so on, and there are people asking serious questions about what this government is doing. One of the things that they did, if you remember, I said on 12th March they only had the capacity for 5 tests in a single day, and the Health Secretary committed to getting 100,000 tests per day by the 30th of April.
Excuse me, how many tests?
100,000 per day. And he actually reached that target on the 30th of April. But to reach that target, if an individual had a test taken, let's say they had on their body, they had a test taken on the throat or maybe even up their nose, they may have had 2 tests performed on the same person. That was counted as 2 tests, but it was really just one person. So he was inflating his numbers. Also, he sent something like 30,000 of these kits out to households so they could self-test. And he had no awareness if they'd self-tested or knew what to do with it. And there were stories of people getting these self-tests, but it didn't even have an addressed envelope where you return it. You return your test, So the figures had been doctored. And he took a bit of battering for that as kind of like misrepresentation. And then just yesterday, the government's #1 statistician from the Office of National Statistics had said that his handling of the numbers on testing and tests was inadequate, that it hadn't been explained properly, that there were some dubious things they were doing with numbers and with counting. And so, you know, so basically we have some strange goings on here. So looking forward, we are now, next week, we will introduce a system of quarantine for people who fly into the United Kingdom. So this could be anyone from the UK, or it could be anyone from Europe or anywhere who comes into this country. They have to go into quarantine for 2 weeks. So, like, if you're coming to visit the UK for a few days, hey ho, that's a joke, because you're going to have to spend 14 days in quarantine. And there are big debates raging about this, big debates. And so, for example, the airline companies who are looking at severe financial difficulties because there's no traffic, the airlines are practically dead. You know, it's and how much longer can they continue? You know, this is the big issue they have. It's quite horrendous. You know, so the 2-week quarantine would just kill them. You wouldn't get tourists coming here. You just really wouldn't. And also people here. I mean, so. If you, for example, say, well, I'm going to go for a holiday and I'll go to a country that will accept me. I don't know which country that would be, but let's just say, for example, Cyprus. You go for a holiday, Sweden would accept us, yeah. You go for a couple of weeks to Sweden, but when you come back, you have to self-isolate for 2 weeks. That's a month. I mean, a lot of people just can't do that. It could affect the job and all sorts of things, you know. I mean, so basically it's stopping this. And there's all this internal warfare in the government because the Home Secretary, who you might call a Minister of the Interior, who's a very Brexiteer, hardline Brexiteer, anti-immigrant person, thinks it's a marvellous thing, and she wants to stop people coming into the country. So she's totally signed up for it. But the airlines are going crazy. A lot of business people are going crazy. He's very, very contested, you know. And a lot of people are saying, why are we doing this now? You know, you look at countries like New Zealand. As soon as they found COVID-19, they just slammed the brakes on and wouldn't let people in their country. And they've come out much better than we have. Yeah. And this is the bottom line. They have come out much better than we have. Now, I should say that in this process, and I think particularly around that 5-week period before we went into lockdown, the government was looking very, very seriously at issues of how to finance people if we did have a lockdown. And they came up with quite elaborate schemes for employees, for companies, for people who are self-employed, working on their own, to give them grants or loans or subsidized wages. And so they had quite an elaborate scheme, very, very expensive, cost a fortune, and it's still costing a fortune, and it might roll on over the autumn too. So they have done things like that, and they did do the ventilators and so on, and extra bed capacity. But the major result, the major outcome is the fatalities. Now tell me, Mats, what do you think of the UK fatalities from COVID-19?
They're around 40,000 or something. And that's 10 times what we have in Sweden. But that means that the Swedish fatalities are almost at the same level compared to the population, I would say.
Yeah, well, I think there are different ways you can measure it. You can measure the fatalities as those that happen in hospital through COVID, which is a narrow measure. And some countries do that. And we did start doing that. And then a lot of people, when the care homes crisis erupted, people wanted them included, so they were included in the stats. So that gives you combine them, you get a different statistic. And then another way to look at it is to say, okay, what are the fatalities in, say, the month of May over the past 5 years? That's your average death rate.
Yes.
And how many deaths do we have this month of May in 2020? And what is the excess deaths? By any measure, any of these measures, the UK, and even if you adjust it, say per 100 million of population, per million of population, whatever country is, we come out really bad. We have, apart from perhaps the United States, one of the highest death rates, and I think we're probably the worst in Europe. Yeah. And it is really, really grim. And there's no hiding from that. And you've got to look at that and look at the mistakes that were made over care homes and funneling people into care homes who may have been carrying the disease, the inadequate testing policy. There was some attempt to build capacity and to be, I mean, I think our health service has been absolutely fantastic. They really have. I mean, they've worked their socks off. Done, I mean, a lot of them working in 12-hour shifts, you know, day after day, and they've done remarkably well. We've also had a lot of fatalities of people who are in primary care. They're right in there, healthcare providers, right on the front line, who've died from working with COVID patients, which is very, very bad. But I think the reality is the outcome we have here. I mean, when in January we're looking at Italy and thinking, oh, I hope we're not going to be as bad as that. But hey, we've been worse, and worse in Spain, and worse than many countries in Europe. And a lot of it is down to the initial complacency. So, for example, there have now been a number of studies done. There was a study that was done in Scotland which said that if we locked down 2 weeks earlier, it would have saved 2,000 lives. Now, the fatalities in Scotland are just about 2,300. So that would have been, you know, much better than what we have just now. And similarly in England, one of their advisors said that they should have locked down much earlier. But there was this whole hiatus when the Prime Minister was dealing with all sorts of personal issues, and he was also enjoying, as he does, his social life, going to rugby matches and such like. And you could see also in Parliament that they weren't social distancing, and a lot of them went down. A lot of the government ministers went down with COVID-19. You also saw them even when they were doing their initial press statements, they weren't social distancing, and then outside as well, they're all kind of standing together. You also saw that in the United States with Donald Trump and his crew. I mean, they had no concept of how infectious this nasty little beast was. So it's been horrible, really, really, really grim. And we've lost so many people, and you know, will be a big public inquiry when this is all over, and there'll be big serious questions about the competence of our current government to deal with the situation. And I think there'll be a lot of people who felt that we should have acted sooner, earlier. The byword of the Jacinda, the New Zealand Prime Minister, was, we went in hard and fast. Well, we didn't. We were very slow.
What do you think, how the communications between the different parts of the administrations in the UK, how did how well that work? Or how much?
I think they've started pretty well, but I think that if you look at, for example, Northern Ireland, they've got quite a dispersed population, not a big population. It's only about 1.5 million, but they have a very low death rate. So they have kept to the rules, and they are still doing these really tight rules, you know. So they've kept to them, and they've done well. Then you look at Wales. Wales has done worse. I mean, it's not a very small, it's a small part of the UK, but by Jeff, his mortality is really, really high. Scotland has done okay, but England, in the north of England, as we speak, there's a lot of infection. And one of the things about that's happening in the UK at the moment is that a lot of the infection started in London. It was a real hotspot. And if you looked at what was happening globally, you had cities like Milan, cities like Madrid, cities like New York, cities like London. These are very attractive cities for people coming in, spending money, enjoying themselves, going to clubs, doing all sorts of things. And it's a breeding ground for COVID-19. An interesting example in New Orleans, where before Mardi Gras, there were only 19 cases of COVID, funnily enough, COVID-19, 19 cases before the Mardi Gras. The Mardi Gras went ahead, and of course it's very people closely packed together, enjoying themselves, having a good time. And after Mardi Gras, their cases jumped from 19 to over 2,000. It's so obvious it spreads from human to human. That is the basis by which it goes. I mean, if it's left on its own, it'll just die. But if you put yourself in this situation where people are jostling against each other, and of course people are completely unaware if they have it or not, because they may have it, but there are no signs. It may take a little time for the symptoms to come through, and but they're still spilling these these viruses. So it's been quite different over the UK, and as we speak in the north, it's very, very difficult. And one of the things about our government is it beats its own tune. So he's trying to say, right, everybody must go back to school. We're ordering everybody back to school on 1st June, But a lot of people are very anxious about, will their kids get the virus? And then there's some evidence which says, well, kids don't get the virus, they're okay. And then some people suspect the kids have been carriers of the virus. And then there certainly are some kids who've had very, very severe respiratory problems, which is related to COVID-19. So the situation with children is not simple and not straightforward. And
the schools were never closed in Sweden.
Never. Jeez. Did that work well for you?
It's impossible to say.
Yeah. Well, I mean, for us, we closed the schools. Apart from we had the children of key workers, the schools were kept open for them so they could go and do their key work. And key workers were like in, medical care homes, food distribution, and so on. But no, so I think that I would say that the UK experience has been humbling, disappointing, deeply, deeply disturbing, a very, very unhappy experience and outcome. And I think that when next year's public inquiry is held, if they hold up this government as an example to the world of good practice, I will fall off my seat. I will eat my hat. It just can't be. I mean, it's the fatalities tell the story. The outcome is a lot. If we had acted earlier, thousands of people would not have died. That's my view. Really sad. Really sad.
Thank you.
But it's nice talking to you, Matt. It really was a pretty serious topic.
I would just
to go out with them, have a beer with them, go to a restaurant with them, go into the university, meet them. And Lund's a great place, and I miss it. And I hope things work out for you guys because you're really good people.
Thank you.
Well, it was nice talking to you, Mats.
Nice talking to you. Thank you for your time.
You give my regards to any of the Lundensians. Of course, I am now Lundensian, because I got that honorary degree.